Greetings of peace. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Good day to each and everyone. So today we will start our discussion for mental health nursing or your psychiatric health nursing. Okay? So for this course, course subject, we have different objectives. First is to define mental health and mental illnesses, discuss factors influencing mental health, explain roles of your psychiatric nurses, identify common mental disorders, and describe nursing interventions that would improve the well-being of a patient experiencing different mental disorders. So now let's define first what is mental health. Now, accordingly, mental health refers to a state of well-being in which individuals can realize their abilities, cope with normal stresses of life, work productively, and contribute to their community. It involves emotional stability, psychological resilience, and the ability to maintain meaningful relationships. So again, it is a state of emotional, psychological, and social well-being. So mental health usually focused on how we react to environment and how we adjust to our environment or our external environment. Now, it includes also our capacity or ability to cope with stress, okay, productive functioning. So you can perform your activities daily of living and capable of maintaining or having your own decision making, okay, and able to have a good and positive relationship with other people, not just intimate relationship. This includes your relationship with your friends, families, and other people in the society. Now, what are the characteristics of a mentally healthy person? So how can we say that a person is mentally healthy or psychologically healthy? First, they have positive self-concept, or having an accurate and favorable understanding of oneself, recognizing both strengths and weaknesses. So a person who has a positive self-concept knows their strengths and weaknesses. Okay? Another is growth and self-actualization. It is the ongoing process of realizing one's potential and striving for personal fulfillment. So if you can what they call this, recall the theory of Abraham's Maslow's of hierarchy, which is self-actualization is the very last motivation, goal motivation of a person. So this motivates us to be better and better and to achieve our needs in life. No? So another is we have integration. It is the ability to maintain a cohesive sense of self-balancing emotions, thoughts, and behavior. Okay? Next is autonomy. A person or a mentally healthy person has autonomy or the capacity to make independent choices and take responsibility for one's action. Another is perception of reality. So seeing the world clearly, understanding situations realistically, and distinguishing between imagination and actual events. And the last characteristics of a mentally healthy person has environmental mastery. So this ability to manage life circumstances, utilize opportunities, and adapt to challenges effectively. So a mentally healthy person typically demonstrates a positive self-concept, emotional balance, and the ability to adapt to change. These individuals are capable of forming relationships and managing stress effectively and maintaining independence while functioning in a society. So overall, people who has positive self-concept, emotional balance, and ability to change or to adapt into changes in our environment is a qualification or characteristics of a mentally healthy person. Okay? So now let's talk about what do you mean by mental illness. So if we have learned that mental health is the state of well-being in which individuals can realize their abilities, so that only means that the abnormality in this state, okay, or if there is an abnormality of or disturbances on the state of well-being in which an individual can realize their abilities, cope with normal stresses, is what we call your mental illness. Or this refers to disturbances in thinking, mood, behavior, or emotional regulation. These disturbances may interfere with daily functioning and relationships. Mental illnesses vary in severity and may include conditions such as depression, anxiety disorders, schizophrenia, and substance use disorders. So again, mental illness is defined as disturbances in thinking, feeling, and behavior, which causes a distress and impaired functioning of an individual. So this person or people who experience or who has mental illnesses don't have the capacity to realize their abilities to cope with normal stresses of life, work productively, and contribute to their community. So, this may affect the perception, their cognition, and their relationships. So, now let's talk about the mental health continuum. Okay. So, mental health is best understood as a continuum. When we say continuum, you start from the very first stage up until the last, okay? So meaning individuals may move between wellness and illness depending on stress levels, coping mechanisms, and environmental factors. A person who is mentally healthy today may experience mental distress later due to life stressors. Okay, so again, from the word continuum, it is a continuous process. You either on you're either in the on the ups, or lately you're on downs. Okay, so we life has ups and downs, the same with your mental health. So it's a continual process. So there are times that you are in the happy state, okay, and then there are times you're in the sad state. Okay, so we have here levels, okay, different levels of mental health condition, and examples of a mentally or our status of mental health. So, mentally healthy, again, example, a student managing stress effectively. Okay, so remember the characteristics that we have discussed earlier. They have positive self-concept. They are capable of adapting to changes in the environment. They have autonomy. They have emotional mastery. These are just some of characteristic a person who is mentally healthy has. Okay, and then we have mild distress. If you, example, if you feel anxious before exam, if you feel anxious after before an interview, these are just some of mild distress. A moderate distress may include frequent panic attacks. So panic attacks is a changes or fear of the unknown. Okay, so there are times that you feel anxious all the time, okay, and you don't know what's the reason. And last but not the least is you may experience a severe mental illness, such as severe depression, which requires hospitalization. So let me just give another example based on what we experience daily. So a mild distress can be an example of, let's say, um, your salary was deducted because of being late or absent in work. Moderate distress may include, let's say, a death of a family member, okay, that will cause you a moderate distress, okay, and some may lead to severe mental illness if they are not capable of coping after a death or after a loss of a family, of a loved ones. Okay, so this may continue and then you may recover from it, and then you will become a mentally healthy, and then later on you will experience mild distress, moderate distress that may lead to severe mental illness. But again, not all, that doesn't mean that it is a continuum. Not all can experience mental illness. Okay, it is only based on how we are capable of coping to stress, how we manage stress effectively, how can we manage our tempers, our feelings, our emotions. So not all can experience severe mental illness. So there are people who can experience, and we have to accept that as a reality. Okay? So, what are the factors that may influence mental health? So, first, we have your biological factors, we have your psychological factors, we have your social and cultural influences, and we have your environmental stressor. So, let's define those factors, okay, and identify what specific factors included, what different factors that is included in this specific factors influencing mental health. So for biological factors, this may include genetics, okay, predisposition, brain chemistry, hormonal changes, and neurological conditions. For example, imbalances in neurotransmitters such as serotonin and dopamine may contribute to depression or schizophrenia. So this is more on based on biology. Okay, your composition as a human being. Okay, so from your genes, coming from your parent genes. So this is all about the biological factors. Next, for your psychological factors, this includes personality traits, your personality development, your emotional development, trauma experiences, coping skills or coping mechanisms, and self esteem. Individuals who experience trauma or chronic stress may be vulnerable to mental health problems because of that instances, this may lead to, or this factor, this may lead to different mental health illness. So let's just like here during the Marawi siege, if you're familiar with what happened here in Marawi, so we had a siege. Armed forces from other countries tried to cause war, okay, within the Marawi city. So there were, if I can still remember, there were increase of number of people or individuals who experience mental health problems. Okay, actually that was the very first time that mental health problem was accepted in our society, especially in our community, in Maranao community, because we have this kind of pride and cultural. I think it's a culture norms that mental illness is a taboo. So many of the families here try to hide their family members who experiences mental health problems. So by the time that Marawi siege happened, a lot of individuals experienced that one. So there was an increased awareness of mental health problems, and maybe it paved the way to understand really what is mental illness and mental health problems. So it was not that easy to really what they call this, give services to people who has closed minds about mental health problems. Okay, so another factor that may influence mental health is your social and cultural factors. So this may include family relationships and environment, your economic status, your cultural beliefs, and your support system. So for example, strong family support may improve coping, while poverty or social isolation may increase stress, especially nowadays, no, especially here in the Philippines. We're facing economic crisis right now, I think globally. So many are experiencing mild distress, even moderate distress about what they're gonna do, okay, what will happen to this crisis, if it is imminent, or it can be reversible or what. So there's so many questions, no, that may cause distress right now. So these are what we call social and cultural factors. So let's discuss the historical perspectives about mental illness. Okay, so In ancient times, we believe on supernatural beliefs. We had this asylum movement, and we had moral treatment about about individual who experiences mental health problems, and this were the time, okay, na we will also discuss some of the development of psychiatric nursing. So during the ancient times, people in ancient times believes that sickness indicated displeasure of the gods, and in fact was a punishment for sins and wrongdoings. So we do believe that being distressed or may experience mental health problem is a punishment from God because you're not beloved, or you did a sin, okay, unbearable sin that may result to this kind of punishment. No, those with mental disorders were often viewed as a divine or even demonic. So it's either divine, especially those people who can say that, who will tell you that I can see God, I can feel Him, His presence, okay, and then they will have telekinesis or anything that are somewhat magic. I don't know what it is, but they do believe that they have this kind of power. So because of that belief, people also may believe that they also have those powers, okay? So it may be, you may be a divine or a demonic. So divine worshipped and adored, or demonic if you are ostracized, punished, and burned at the stake. So usually this is yung bad witches. I think you're very familiar with this ideologies, the bad witches, good witches, okay? Those who believe in dark magic, like that, and so on and so forth. So that was way back. No? So we don't have enough knowledge about science. Okay, so biology. So we have that kind of ideology. No? So Aristotle developed his theory that the amounts of blood, water, and yellow and black bile in the body controlled emotions, and this four substance, or what we call humors, based on his theory, corresponds with happiness, calmness, anger, and sadness. Imbalances with the four humors were believed to cause mental illness, and treatment was aimed at restoring balance through bloodletting, starving, or purging. So during the Renaissance, people with mental illness were distinguished from from criminals in England. Those considered to be dangerous lunatics were thrown in prison, chained, and even starved. So in 1547, the Hospital of St. Mary of Bethlehem was officially declared a hospital for the insane, the first of its kind. So actually, during ancient time, the treatment, okay, for mentally ill persons is not really good. Okay, it's really bad. They were what do you call this? They were abused. Okay, they treated this human like animals, because at some point they do and think, or they do what animals do or think what animals think, because they don't have sanity. Okay, so that causes that kind of behavior from human being, even though it's not right. However, because of this beliefs as such, you are a demon, you've been punished, you're not liked by the gods, and like that, and so on and so forth. So that's why people will tend to do actions like that against other people. Okay, so during the period of enlightenment, which began in 796, Felipe Pinel and William Tux formulated the concept of asylum, which is a safe refuge or haven, a safe haven offering protection at institutions where people had been whipped, beaten, and starved just because they are mentally ill. So during the period of enlightenment, the treatment for the mentally ill person were improving. Okay, they provided a refuge, okay, offering protection against those people who causes or who beats another people that is mentally ill. Okay, so in the United States, Dorothea Dix began a crusade to reform the treatment of mental illness. So during the scientific treatment of mental disorders, which began with Sigmund Freud, Emil Kraepelin, and Eugene Bleuler in 1856 to 1939, with these men, the study of psychiatry and the diagnosis and treatment of mental illness started in earnest. So these three men actually tried to study psychology and psychiatry. Okay, they were able to identify the different needs of of an individual. How do we what do you call this? Our cognitive and emotional development, okay, in relation to in our environment. So Freud studied the mind and its disorders and their treatment. Kraepelin began classifying mental disorders according to their symptoms, and Bleuler coined the term schizophrenia. So this, during the period of scientific treatment of mental disorder, there was a great leap of the treatment of mental illness, which began in about 1950 with the development of psychotropic drugs, or drugs that used to treat mental illness. This may include your chlorpromazine, which is your thorazine, an antipsychotic drug, and lithium, an anti-manic agent, were the first developed during this time. So by this period, the mentally ill experience understanding from lots of people. Some of the people now began to accept that there are this population that may experience this kind of problem, and they need to be treated, and they need to be well treated. Okay, so in the development of your psychiatric nursing practice, so by the time of period of scientific treatment of mental disorder, here comes the ideology of your psychiatric nursing practice. So, Nursing Mental Diseases by Harriet Bailey is the first psychiatric nursing textbook published in 1920. Two early nursing theorists shaped psychiatric nursing practice includes Hildegard Peplau and June Mello. Peplau published interpersonal relations in nursing and described the therapeutic nurse-client relationship with its phases and tasks, and wrote extensively about anxiety. So during this time, actually, nursing was present. However, psychiatric nursing practice is not really pronounced, or not really on the field, okay, or not really studied. So by the time that Hildegard Peplau introduced the ideology of nurse-client relationship, and it is part of being a therapeutic. Okay, so this continued the idea na this type of theory may be, or a good practice to improve the well-being of those people that experiences mental disorders. So Mello contended that the nurse as therapist is particularly suited to working with those with severe mental illness in the context of daily activities, focusing on the here and now to meet each person's psychosocial needs. So let us define what is psychiatric nursing. So psychiatric nursing is an interpersonal process that strives to promote and maintain behavior which contributes to integrated functioning, and is directed towards both preventive and corrective impacts on mental disorders and their sequelae, and is concerned with the promotion of optimum mental health for society, community, and the individuals who lived it. So based by Stewart, again, it is a interpersonal process. Okay, interpersonal process. When you talk about interpersonal process, it includes the psychological aspect of the nurse and also the patient to promote and maintain behavior which contributes to integrated functioning. So we help other people to function properly by promoting and maintaining a good behavior within the relationship. So it is directed towards preventive and both corrective impacts on mental disorders. So again, psychiatric mental health nursing by Association of American Nurses Association is a diagnosis and treatment of human responses to actual or mental health problems. Okay? So, yun po yung, that is the psychiatric nursing practice. Now, in modern healthcare, today, mental health care focuses mainly on community-based treatment, your recovery-oriented care or recovery models, your interdisciplinary approach and collaboration, and patient-centered care. So the goal of modern mental health care today is to help people or help individuals live a meaningful and productive lives in the community. Either they are experiencing or they have the mental illness, and by the time they recover, the goal is to help them or help this individual live a meaningful and productive lives in the community. So what are the different roles of psychiatric nurses? Okay. So first is psychiatric nurses provide holistic patient care, which includes your mental health assessment, medication administration, patient education, counseling, and coordination with other healthcare professionals. So we also provide therapeutic care. So if we talk about therapeutic, meaning you give benefits, okay? An individual or a patient can get benefits, or they can improve their well-being by establishing a good and therapeutic relationship with you, with the nurse, no? Assess mental health status, administer medications that are needed by the patient, and to support their recovery. Again, the goal is to help them live a meaningful and a productive lives in the community. Even they are in the hospital setting or community setting, we wish to help them improve their well-being. Okay, so let's talk about the competencies or the different competencies of your mental health nurses. So first, a mental health nurse or a psychiatric health nurse must have a good competency on communication skills, because this is very, very important, especially the application of your therapeutic communication. And a therapeutic communication should be effective, because if it's not effective, if it's not therapeutic, then it is not a good communication skills. Next is you have to have a good critical thinking. Okay, it is the capacity or our ability to understand the disease process of the patient, and by this or by having this critical thinking, we're capable of making good clinical judgments. Another is empathy and compassion. Again, avoid providing or making feel that the patient making feel to the patient that you sympathize with them. No, it should not be sympathy, it should be empathy. Okay, and your compassion. Again, nursing is an art and it is a caring profession. You need to be compassionate to your patients. Okay, and you should have a good ethical decision making. So you have the capacity to apply those different ethical principles when you decide for your patient, or when you wish to become an advocate of your clients. So you should have this good characteristics and competencies. So they must also maintain professional boundaries while establishing therapeutic relationship. shifts. So now let's talk about therapeutic nurse-patient relationship. So again, this is by the theory of Hildegard Peplau. So Hildegard Peplau discovered or introduced the idea of the nurse-patient relationship to become a therapeutic. So it is a foundation it is the foundation of psychiatric nursing. So the therapeutic nurse-patient relationship is a foundation of psychiatric nursing. It is a professional relationship, a helping relationship, again, which focus to help the patient understand their problems and develop healthier coping strategies. So again, therapeutic nurse-patient relationship is the foundation of your therapeutic psychiatric nursing. It is a professional relationship focused on helping the client understand their problems and develop healthier coping strategies. You will not solve the problem of the patients, however, you will help them cope with their problem, so that if they are capable of coping with their problems, now they can look for the solutions. It's not your it's not your responsibility to look for answers for solutions of the problems of your patient. However, it is your job to help the patient realize that there is a problem, and they have to accept it for them to realize and for them to have a good coping strategies to resolve their own problems. Okay, so that's a big difference. So again, we're not focused on helping the patient solve their problem. We're not problem solvers. We are helping the client understand, accepts their problem, and helping them cope with this problem so that they can, in their own ways, they can solve their own problems. So what are the components of your nurse-patient relationship? First is trust. Okay, the consistency and the congruence. This includes your being friendliness, caring, understanding, honesty, and listening. So that is why it is very, very important that you should establish good rapport and trust to your patient. Because if the patient doesn't trust you, then there will be no any nurse-patient relationships to be built. Next, genuine interest. You should be truthful, okay? Not just because I'm doing this because it's my job. No. You should have a genuine interest in understanding the needs of your patient. Another, acceptance, avoiding judgment, especially what happens to the patient. We don't do judgments, okay? We accept for what they are. We can correct them with what they believe if it's wrong. But if it's morally wrong, we have to make sure that our decisions is based on objective, not on subjective, not on our personal views, not on our on opinions. It should be facts, based on facts. It should be objective decision. Okay, another is positive regards. So you need to respect, even though they are mentally ill, they don't have the capacity to think, to collect their emotions, to understand what's their problem. So you have to respect them at all times. And last but not the least is empathy. Ability to perceive meaning and feelings of client and communicate that understanding to them. Okay? So what is the goal, or what are the different goals of the therapeutic nurse-patient relationship? First, to promote patient growth. This is why we improve, or we don't like that the patient will be dependent on us. So it is focused on patient's growth and maintaining their independence, okay, and promoting their independence. Either promote or maintain their independence. Another is encourage self-awareness. They need to be aware of their ideologies, ideas, which is actually it should be done also by the nurses. That's why in community health nursing, when we go to our when we go to the hospitals, it's very important that you are or that you have good self-awareness. You by doing that or by having a good self-awareness, we tend to avoid what do you call this, transferring emotions, our own emotions to our patients. We are capable of understanding them objectively. We don't judge them because we know that this is because you we know that your opinions is not all about that, okay? Or it is not all about you. You have to be focused on the patient. Another goal is to develop coping strategies. So what are the different phases of your nurse-patient relationship? First, pre-interaction, orientation, working, and your termination. Now, during the pre-interaction phase, this includes reviewing of the patient's record and doing self-awareness. So, you will gather data from your patient, no? Understanding what are their cases, what are their problems, what are those developments that happen to during the course or treatment course of the patient. So, during the pre-interaction phase, from the word pre-interaction, there has no interaction been made, no, from the of the patient and nurse. So the nurse haven't seen the patient actually. Okay. Now during the orientation phase is the phase that the patient, the nurse meets one another. Okay, so there will be an agreement of contract. So it's very very important that you will have an agreement or a contract with your patient with this before establishing your relationship. So you have to set boundaries. Okay, as a nurse, this is my interventions. This is the only time that you can capable they are that you are able to call me like this and like this, because if you don't set boundaries, they will expect more from the relationship. And remember, they are not mentally stable or they are not in good mental status, so you have to agree or to have a contract or agreement with your patient. Another is establish trust and rapport, demonstrating acceptance and non-judgmental attitude, showing congruence, consistency, establish therapeutic environment. Your roles, your goals, your rules and limitations should be or are defined. So during the working phase, this is the time that you will work together to identify the problems, to help the patient cope up with their problems, and let the patient be independent and make their own decisions if they are capable of making their own decisions. So this may include coping mechanism and support systems are identified, problems are identified and solutions are explored, applied and evaluated, implementation of action plan, and evaluation of the results. And the last phase of a client or nurse patient relationship is a termination or your resolution phase. This is when mutually agreed goals are met, patient is discharged or transferred, or the rotation is finished, promote self-care, and increase the independence and establish environment support. So these are the 4 nurse-patient or nurse-client relationship. Again, it starts with pre-interaction. After pre-interaction, so you will now have a good insights about the patient. Then you will meet the patient during orientation phase. Again, it is very important during the orientation phase to set your rules, your limitations, your boundaries, and make an agreement or contract. After your orientation phase, then you will work together. What have you planned during the orientation phase? What are the goals that you wish to meet? So you work hand in hand. Again, and the last one is your resolution or termination phase, wherein the patient have achieved independence and established a good environmental support, okay, and the goals were met. So what are the different barriers or some barriers to nurse-client relationship? First is your resistance. It is the unconscious avoidance of patient to recognize unconscious and preconscious troubling or anxiety-provoking aspects of oneself. So, it's really hard if the patient is very resistant against your interventions or against your presence. Okay, so you really have to establish a good relationship with your patient. Another barrier is your transference. So when we say transference, this is when a patient transfers or displays conflicts or feelings and wishes towards other people or from his or her past to the nurse. Example, she wishes to be with her husband, and then here comes, you're the nurse, and then she liked you and everything and so on, so she wishes you to act like her husband. So that's transference. Okay, so you have to this is where you set boundaries. This is where you have a agreement and contract with your patient. Another is your counter transference. So if transference is all about when the patient, okay, transfers or displaces conflicts emotions to the nurse, counter transference happens when the nurse responds to the patient emotionally or on a personal level. Let's say you talk to your patient and then you had the same experience as such. The reason why she had mental disorder because her both parents died in a car crash, and you had the same situation. However, you're not mentally ill. You were able to cope up with it. However, because of rekindling the idea, the memories that like that, and you had the same or similarities or similar experience, then you may respond to that kind of emotional problem or emotional level. So at this point, the self-awareness of the nurse were not really understood or not really accepted by the nurse itself. So this is the reason why you should know your feelings, your emotions, your mental health. Okay, you should know your own beliefs, your personalities, your behavior, because if no, then you may experience counter transference. Okay, so now let's talk about therapeutic communication. So if there is a therapeutic relationship, which means a good relationship or a type of relationship that helps the nurse and the patient, especially it's a patient-centered relationship, which helps the patient improve their well-being. Now, we also have the term therapeutic communication. So it is a communication or an interpersonal interaction between the nurse and patient during which the focus is the needs and problems of the client and with the goal of effective exchange of information between the nurse and the patient. So it is the heart of psychiatric mental health nursing. So if therapeutic relationship is the basic foundation of psychiatric nursing, the heart of psychiatric nursing is therapeutic communication. So if you can still remember in your communication process, there are 4 components that needed to be there are 4 components in a communication process. First, there should be a sender. There should be a message that needs to be sent by the sender. There should be a receiver, and there should be a feedback. Now, if these 4 components is not followed, or if there will be one component that is not accepted, or what they call this, not done or not present in the type of communication you have, then definitely that is not a communication, but it's just a one-way communication, and there will be no therapeutic effect to the patient. Okay, so the objectives of your therapeutic communication is to establish a therapeutic relationship, help the patient identify problems, underlying needs, and the patient's perception of his problems, guide and assist the client to explore and apply possible solutions to his problems. So we have different therapeutic communication techniques that we can use during our rotation in psychiatric health nursing, or um, ano to, interacting with a patient that is or that experience mental health problems. First is offering self. This is making yourself available and showing interest and concern. Another technique is active listening. So listening and active listening is not really the same. You listen, however, not all of the details, the verbalization of feelings of patients were really noted. However, active listening is the paying attention or close attention to what the patient is saying and by observing both verbal and non-verbal cues. So, this includes maintaining eye contact and making verbal remarks to clarify and encourage further communication. Another therapeutic communication technique is exploring. So, you allow the patient to explore their feelings and to verbalize their feelings more. So, next is giving broad openings. So, what do you want to talk about? Because giving broad openings helps the patient decide to what topic should they discuss. So you're giving the patient the autonomy to what do you call this, decide to what they have to talk about. Okay. Another is silence. So planned absence of verbal remarks to allow patient and nurse to think over what is being discussed and to say more. So silence is better than talking or than saying anything that would really hurt the feelings of the patient. So by the moment that you see your patient having distress, having tantrums or having mild breakdown, so you let them feel their emotions. You let them be. Just make sure that they will not harm themselves or other people, then it's fine. Okay? By being there, not talking, it gives the idea to the patient that, okay, this person doesn't judge me, okay? They accept me for who I am, and these people respects me, okay? So they feel valued by the nurse. So next is stating the observed, verbalizing what is observed in the patient too, and for validation and to encourage discussion. Another is summarizing. You always summarize or review the main points that have been discussed by your patient, making appropriate conclusion. So by this, you are allowing the patient to really grasp the idea or understand what has been discussed and review on the things that she or he said, and then you can also by summarizing also, you will allow the patient to really include other details that he or she didn't say, no? So it helps a lot, okay, to your patient. Another is placing the event and time or sequence, or asking the relationship among events. Example, when do you begin to experience these tics? Before or after you entered grade school, or like so on and so forth. So example, when did you experience being sad and isolate yourself? So it's about this was the time during the ganito, ganito. So you will now understand the sequence and events of the situation of your patient. Another, encouraging descriptions of perceptions, asking the patient to describe their feelings, perceptions, and views of their situation. Another is presenting reality. Always present reality to your patient every time that he or she experiences delusions, hallucinations, illusions. Okay? So, stating what is real and what is not without arguing with the patient. However, take note, there's this sentence, without arguing with the patient. If the patient doesn't accept what you have stated, and the thing that you have stated is the fact, then you have to respect them. Okay, it's important that you have stated that, but it doesn't really it's not really that important that you will coerce the reality to your patient, because this may cause a distress to your patient. Okay, another, verbalizing the implied, rephrasing patient's words to highlight an underlying message, to clarify statements. So another, we have our stating. from the word restating, repeating the exact words of patients to remind them what they said and to let them know they are heard. Another, general leads, using neutral expressions to encourage patients to continue talking. Another, asking questions, using open-ended questions to achieve relevance and depth in discussion. However, it's not just about open-ending question. We can also ask closed question if it's necessary. As such, let's say, did you experience any anxiety today? Yes or no. Okay. Are you not feeling okay today? Yes or no. So these are some close-ended questions. If it's needed, then you have to. But if it's not needed and if you wish to let the patient verbalize their feelings more, then use broad or open-ended question. Another, empathy, recognizing and acknowledging patients' feelings. And we have focusing. We have pursuing a topic until its meaning of or importance is clear. However, do not include any ideologies or anything that pop up to your mind na focused on yourself. Most of the time, the message of your or the exchange of information should be focused on the patient. Another is limit setting, discouraging non-productive feelings and behaviors and encouraging productive ones. So that is why, as mentioned earlier, in nurse-patient relationship, it is very important that during orientation phase, you have to set boundaries and limits, because there are emotions, there are instances or situations that may go beyond your limitations. So you have to tell the patient of that limitations. Another, supportive confrontation, acknowledging the difficulty in changing but pushing for action. So next is role playing. Okay? So role playing includes practicing behaviors for specific situations. Both the nurse and the patient play particular role. Now we have also feedback. So pointing out specific behaviors and giving impression of reaction. So I see you combed your hair today. I see that you brushed your teeth. I saw that you drank or you drink your milk. Okay, ganito. So you note or give good feedback. Okay? Encouraging evaluation, asking patients to evaluate their actions and their outcomes. And last but not the least is reinforcement. So, reinforcement is giving feedback on positive behaviors. Not behavior should be reinforced and must be given feedback. Those who are not good, those actions that are bad and not good, such as they may cause harm to the patient, harm to others, they may increase or they may cause another problem to the patient. So this should not be reinforced. Okay, so giving feedback on positive behaviors only. Now let's talk about the non-therapeutic communication techniques. So again, these are techniques that are non-therapeutic. So these are the techniques that you must avoid. First, overloading, talking rapidly, changing subjects too often because you're not interested. Again, it is not all about you. It is all about the patient. If you're not interested, you wait for the patient to finish his or her story. Next, value judgment, giving one's own opinion, evaluating, moralizing, or implying one's values by using words such as, that's nice, that's bad, that's wrong, you should not do it, you should not to do it, ganito. So, these are value judgment. So, you have to avoid that one. Again, it is needed that you need to know what is good or bad. However, you don't criticize your patient. Another, incongruence, sending verbal and non-verbal messages that contradict one another. So example, the nurse tells the patient, I'd like to spend time with you, and then after saying that, he or she walks away. So that's a contradiction. Another, underloading, remaining silent and unresponsive, not picking up cues and failing to give feedback. You just listen, okay, I will just apply active listening like that, and then no feedback at all, no response. Again, feedback is very important for communication process. So if there's no feedback, there is no communication. Next, false reassurance and agreement. Using cliche to reassure client, you will be okay no matter what. Okay, your family will visit you next week. Pero wala, no? No, nothing at all. So that's a false reassurance. Another, giving false hope to your patient. So another is invalidation, ignoring or denying another's presence or thoughts, feelings, or ano to? Or feeling. Sorry. For example, the patient greeted you and then you didn't greet back. Okay, the patient asked you some question and then you didn't answer his or her question. So that is ignoring or invalidation. Another, focusing on oneself. Responding in a way that focuses attention to the nurse instead of the client. So another is changing the subject. Okay, so introducing new topic inappropriately, a pattern that may indicate anxiety. So the client is crying when the nurse asks, "How many children do you have?" Okay. Next is giving advice. Again, we don't give advice. We advocate for the patient. However, we don't give advice. We either give facts about the decision or anything, any information. It should be factual, it should be by book, it should be by the rules, professional rules and regulations of nurses, not based on your own experience, own judgment, own opinion. So next is internal validation, making an assumption about the meaning of someone else's behavior that is not validated by other person. So ito yung this is what we call you're giving meaning to the actions of others. However, that is not what he or she intends to. Okay, that is why you have to respect others. You don't know what others think. You don't know what is their motives by doing this action. So you have to respect that. And if you're not if you don't understand it, you can ask them, okay, what's your motive behind this one? So what's your reason? Why did you do this? So by understanding these motives, reasons, you are allowing the patient to be, to feel validated, to feel acknowledged, to feel respected. Okay, so another ineffective behaviors and responses may include requesting an explanation, such as, why did you do that? No, literal responses, looking too busy, appearing uncomfortable in silence, being opinionated, avoiding sensitive topics, arguing and telling the client is wrong, making false promises, and then ignoring the client, making sarcastic remarks, laughing nervously and slowly, disapproval, or showing disapproval to the clients. Okay, so now let's talk about the common medications. However, this is just a quick discussion. Okay, we will have another unit that focus on psychopharmacology. So some of the psychiatric medications that are used in treating mentally ill patients, we have antidepressants, antipsychotics, mood stabilizers, and anxiolytics. Antidepressants, from the word depressants, is usually used for depression patients. Okay, antipsychotics, such as those who has thought disorders such as schizophrenia or schizoaffective disorders. Mood stabilizers, this is for bipolar or manic or depression, manic behavior. And then anxiolytics for people experiencing anxiety disorders. So what are your nursing responsibilities, especially in medication administration? So first, you need to monitor side effects. So How can you monitor if you don't know? So you have to learn what are the different side effects of these certain drugs, educate patients, and promote medication adherence. Actually, in psychiatric nursing or mental health nursing, it is very important that we follow or to adhere to the medications, because we don't know when does the symptoms will happen, will erupt, okay? And avoiding or stopping the medication abruptly may lead to complications, or this may further increases the problem of the patient. Okay, so ethical and legal issues that may be included in psychiatric nursing practice, such as first, confidentiality, protecting patients' information, informed consent. So make sure that the patient agrees to the treatment you give, even though they are not mentally sane. However, the next of kin or their family should be aware of your treatment. Patient autonomy, list restrictive care, which provides freedom while ensuring safety. So example, a nurse must not disclose a psychiatric patient or condition to others without their permission. So, in conclusion, mental health nursing or psychiatric nursing integrates science, empathy, and therapeutic skills. Nurses play a key role in promoting recovery of the patient. So, make sure that you apply the two most important things in psychiatric nursing practice, which includes the foundation, which is the therapeutic relationship, and the heart of psychiatric nursing, the therapeutic communication. So that will be all for this video. Again, if you have questions, clarifications, do not hesitate to comment directly in this video for I can so that I can read your comments and I can answer your questions. So thank you for watching. Have a wonderful day.